hello everyone, I am Desiree L Sacare from BSN and today I'm going to demonstrate the bag technique. But first, I want you to know what is bag technique, its purpose, and the material that you will be needing to put inside the bag. So, what is bag technique? Bag technique is a tool by which the nurse, during her home visit, will enable him or her to perform a nursing procedure with ease and deftness. So the purpose of bag technique is it is also an essential and indispensable equipment of a public health nurse which he or she has to carry along during his or her home visit. This is also to save time and effort with the end view of rendering effective nursing care to the clients. So now, I'm going to show you first the contents of my CHN bag. So, so this is my CHN bag. So inside of our CHN bag are the materials. So this is a plastic lining, the paper lining, and then we have an apron, then a hand towel, soap in a soap dish, then we have an alcohol lamp, the next is one pair of sterile gloves, then sterile dressing, the next is cotton balls, tape measure, thermometer, micropore plaster, then 2 test tubes, then test tube holder, two pairs of forceps which is curved and straight, then 2 pairs of scissors which is bandage and surgical, and then disposable syringe, and I only have 20, 25 and 23 gauge. Then next is an hypodermic needles which is 19, 23, 22 and 25, but I only have 22 and 25 gauge. Then the solutions, the betadine and 70% alcohol, then the hydrogen peroxide, then the Benedict solution, then the acetic solution, and that's all. So upon arriving on our patient's home, we will first find a suitable place to place our bag, most likely a table or a flat surface. And we were going to line up our plastic cover and a manila paper. So before putting the bag on the table, make sure to spread or put a paper lining on the plastic lining. So this is to prevent the bag from getting contaminated, and then we're going to put the bag on the left side of the table. And then we're going to open the bag and get the soap dish and a towel. And then close the bag to prevent getting contaminated, and then do hand washing. So now I'm done doing hand washing, and I will be putting this on the side of the table. After that, I will be opening my bag to take the apron, and I will be close it again. So after putting an apron, we're now going to take out the articles or equipment that will be used throughout the procedure. For instance, we're gonna do fundic height measurement. And we're gonna take out our measuring tape for the procedure. So now we're just gonna take out our necessary equipment, which is the tape measure. And then we're going to close the bag. And then we put it one side of our working area so that it will prevent cross-contamination. And now we're going to proceed on doing the specific care. So after the procedure is done, after providing nursing care, we're going to disinfect to clean the materials that were used in the process. So this is to prevent cross-contamination, so we're just gonna wipe everything or using alcohol to clean it. So after cleaning the equipment, we have to perform hand washing to prevent transmission of any type of infection. So now after the hand washing, we will now put the soap in a soap dish and the hand towel in the bag. And then after that, we're going to um, remove our apron. So I'm gonna fold it away and the soil side in and the clean side out. And we're just gonna fold it and we're going to place it in the bag. So after disinfecting everything and washing our hands and taking out our apron, we're now going to remove the lining. Then I will going to fold the plastic lining. And then keep it outside the pocket. And then the paper lining, and then keep it outside the packet. So we have kept everything in our bag already, and all the lining and equipment, and now we're going to discard all the materials that were used in the paper bin. So now we will record our findings and the procedure of the care that was done into our notes. I've also asked our patient if when we can do a second visit, and we have agreed upon that we'll do it in next week again. Thank you.